Hello YouTube, I'm Dr. Fox. Today, I'd like to talk about first gynecologic visit. So first of all, what is an obstetrician and gynecologist? An obstetrician gynecologist or ObGyn is a doctor who specializes in women's health. So when should you first see a gynecologist? I would suggest that girls first see a gynecologist when they are about 15. It is completely normal to be nervous before you first visit, and it helps to know what to expect. Remember, you can always talk about it beforehand with someone you trust, and you can also tell the doctor you are nervous and if you do not understand anything they tell you. So what happens at the first visit? Usually, you will have a chat with your doctor so they can give you general information about your gynecological health and tell you what will happen during visits when you're older. The doctor will probably also ask you a lot of personal questions, for example, about your periods, whether you're sexually active, and if so, whether you have vaginal, anal, or oral sex. If you do not want other people to know any of this information, tell your doctor, and they will make sure it is kept confidential wherever possible. Okay, next, what sort of things can you discuss with the doctor? This is an opportunity to ask a lot of questions about what happens to your body during your teenage years. For example, you might want to tell them if you have problems during your periods such as cramps, or if you're worried about acne or weight gain or loss. They can also talk to you on emotional difficulties such as mood swings or depression, and they can answer all your questions about sex, sexuality, and birth control. They may also give you more general advice about having a healthy lifestyle. Okay, next question. Will the doctor examine you? My answer is sometimes. You can ask to have someone else with you when the doctor carries out the examinations, for example, a nurse or your mother or sister. Usually, the doctor only carries out a general physical examination, but if they think it necessary, they will also do an external genital examination. Then what is a general physical examination? During a general physical examination, the doctor will check your weight, height, and blood pressure and make sure there is no other health problems. Then, what is an external genital examination? During an external genital examination, the doctor checks your vulva. They may offer you a mirror so you can see your vulva as well. This is a good opportunity to learn about your own body and the correct names for each part, so you can describe any health problems accurately in the future. Okay, then, what about a pelvic examination? You will not usually have a pelvic examination during your first visit. However, if you have bleeding or pain, the doctor may do one, and you will certainly have one at some future visits. To do a pelvic examination, the doctor first checks the vulva, then they use a speculum to check the vagina and cervix. Finally, to check your internal organs, she wears a lubricated glove to put the fingers of one hand inside you and presses down on your abdomen with the other. And what about the pap test? You probably won't have a pap test, almost known as the cervical smear test, until you are 20 in Japan. For the pap test, the doctor uses a speculum to look at your vagina and cervix and takes a few cells out of your cervix with a tiny brush. These cells go to the laboratory to check if there have been any changes which might indicate cancer. Next, will you have to give a urine sample? If you are sexually active, the doctor may want to test you for sexually transmitted infections or STIs, for which you will need to give a urine sample. Okay, next. Will you be given vaccines at your first visit to the gynecologist? This is an opportunity to have any vaccines you may have missed. I recommend all young women are given human papillomavirus vaccine, and some also get a yearly full vaccination. Okay, last. What can you do to stay healthy in general? You need to make the right lifestyle decisions now to ensure you have good health in the future. In particular, think about diet, bad habits, mental health, and sex. You can keep yourself at the right weight by eating a well-balanced diet and taking regular exercise. Don't take up habits such as smoking, drinking too much alcohol, or using recreational drugs. If you feel depressed or anxious or have any other mental health difficulties, ask for help. And when you become sexually active or if you already are, use birth control if you don't want to become pregnant. Use condoms to protect yourself against STIs and also sleep with partners who you trust and whose sexual history you know. Finally, don't skip the routine examinations, tests, and vaccinations. Healthcare providers will book for you in the future. Okay, thank you for watching. See you soon.